Aloha everyone, I'm Dr. Tom Johnson from Columbia Total Health Center. Today we're continuing our discussion on discogenic low back pain and discogenic neck pain. Now many of you may not be aware that back and neck pain is the world's leading cause of pain and disability throughout the world. Let me say that again. Low back pain and neck pain are the world's leading cause of pain and disability. Now, of the many causes of the low back pain or neck pain, discogenic or disc-related pain is the most severe, or one of the most severe. The key is early detection, early correction. The quicker we get you in the clinic to properly examine, diagnose, the quicker we can develop a unique and detailed and comprehensive treatment plan that can get you out of pain the quickest and correct that disc-related injury as well, in the shortest and quickest and less costly amount of time. Now, today we're talking about the most frequently asked questions. So let's unpack these questions for you right now. First, can chiropractors help with spinal disc disorders? Yes, we specialize in disorders. However, not all clinics do. Some clinics are more sports medicine. Some clinics are more family medicine. Some clinics are just more, old school basic chiropractic. At Columbia Total Center, we specialize in a very modern approach to spinal disorders. We specialize in advanced spinal disorders. We specialize in disc-related spinal disorders. We have an integrated team of healthcare providers, a multidisciplinary integrated team. That means we have our medical doctor and physician assistant, nurse practitioner, massage therapist, acupuncture, clinical nutrition, chiropractic, physical therapy, an integrated team that is here to help and serve you to our best ability. Next, is it safe to go to a chiropractor with disc herniation? Yes, of course. However, you need a clinic that specializes in these type of disorders. If they're not properly examined, diagnosed, a clinic such as a physical therapy or chiropractic clinic could give you the wrong exercise or the wrong treatment that could flare it up or make it worse. So it comes back to going to a clinic that specializes in these disorders. Now, typically when patients go to their family doctor, the examination isn't even really looked at in terms of the disc-related injury. It's commonly diagnosed as a sprain, strain type of injury, and the treatment typically is anti-inflammatory pain medication and muscle relaxers. There was nothing done in that regard for the actual disc disorder. It was treating more just the cause of the symptoms of the pain, not so much the cause. Yes, it's safe to go to a chiropractor, although I wouldn't go to just any chiropractic clinic. Okay, I'd go to a clinic that specializes in spinal disorders. Next, can a chiropractor put the disc back in place? That's a very old way of thinking. Slip disc. The disc does not slip out of place. It herniates or degenerates or it's torn. The typical treatment is to restore the proper motion and alignment and the forces that load that disc, control the pain, inflammation, swelling, strengthen the spinal cord, normalize the basic movement patterns, return you back to sport or work activity through strength and conditioning and rehabilitation. So no, we don't put the disc back in place, but typically with proper treatment, the disc can be reabsorbed, disc herniation can be reduced in magnitude or severity. So yes, indirectly we heal that disc, but not in the way, the old school ways that are commonly thought. How long does it take a person asks for a disc herniation to heal? Well, that completely depends on the type. If you review previous episodes of discogenic back and neck pain, you'll understand that if this is an acute flare versus a chronic, the treatment plans are different for both, depending on the severity of the magnitude. Is your disc herniation 3 millimeters or 10 millimeters? Is it contained or not contained? Again, review that episode and that'll help fill in the answer to those questions. Next question, can you massage a bulging disc back into place? No, massage therapy will not help the disc. Massage therapy will, however, help the muscle guarding and the muscle spasm that's associated with that disc herniation or disc tear or disc injury. Commonly, muscles spasm to protect the spine. Now, that's good for a couple of days to limit your activity so you don't make the spinal injury worse. However, I don't want that spinal loading, guarding to continue for weeks and months on end. That's where massage therapy can be fantastic to help the ease of the soft tissue spasm. But again, that won't fix the disc. That's just one of the pieces of the puzzle that we need to look at. Next question. What's the basic painkiller for a herniated disc? Well, that really depends on the type, acute versus chronic, the severity, your pain tolerance, any imaging that we have, if there's a spinal nerve root compression or if it's just a disc tear, severity of your pain intensity or pain frequency, occupation, are you working at home or working in the office, are you commuting? So there's a lot of factors involved with what's the best painkiller. typically starting out with over-the-counter anti-inflammatories and rest, and the back braces and ice and heat can definitely help. But however, when you see our medical physicians here at Klein Total Center, we can prescribe you the best medication to get you out of pain the quickest. We also have some other therapies like cold laser therapy to help in that acute inflammatory flare-up, DME back bracing as well. Next, what are the signs of a herniated disc in your back? Well, we reviewed that in previous episodes. Please refer back to them, but typically pain can be sharp, stabbing, local pain in the neck or back, or it can be radiating radicular pain into the shoulder blade, or down the arm, or down the leg. We can have 𝒔𝒆𝒅𝒔, meaning tingling numbness. Again, the pain is usually severe, it's sharp, it's stabbing, and it's increased with movement. Typically, patients will present with a 𝐴𝐴LG𝐴 or a certain lean or posture deformity that is there to guard you from the condition from worsening. Now, can chiropractors make things worse? Well, I would say anything can make things worse. Again, the key is to go to a clinic that specializes in spinal disorders. A clinic like ours that specializes in spinal disc herniations and spinal disorders. Other clinics, whether it's chiropractic, physical therapy, massage, medical, they can make it worse if they don't understand how to diagnose and treat spinal disorders such as discogenic. So yes, a physical therapist can give you an incorrect exercise. You know, a typical family doctor can just prescribe you medication, but do nothing with active care. A chiropractor, if it's not examined properly, can stretch you too much or adjust you and flare it up. So yes, it can be flared up. Again, not all clinics are the same. You must go to a clinic that specializes in spinal disorders like we do at Klein Total Center. Now, another question, can a chiropractor fix the pinched nerve associated with that disc herniation? Yes, we can. Again, not all clinics are the same. You need to go to a clinic that specializes in spinal disorders. But yes, treatment of the disc and rehabilitation of the disc can reduce the pressure on that spinal nerve root that they can allow that nerve to function normally without pain. Another question, what's the best exercise for bulging discs? That's a great question. Again, comes back to aligning yourself with providers that specialize in disc and spinal disorders, okay? Because not all exercises are equal. Some will make it worse, some will flare it up, some will actually make it herniate more. So you need to know what you're doing, all right? Typically, loading the spine in an acute setting is not healthy. What we want is general flexibility and mobility type of exercises, and stay away from very heavy loading like squats, heavy squats, anything that's going to load that disc, okay? Next question, what does a slip disc feel like? Well, first of all, we don't use that term anymore. There's no such thing as a slip disc, okay? That was terminology used in the past. It was never proven scientifically correct. Discs don't slip out of place. They don't just slip back in. That's not the mechanism of injury. It's a very folklore. It's a common wording from the past. Typically, we talk about disc herniations, disc tears. What does it feel like? Well, we already answered that in a previous episode and a previous question, but typically pain is sharp and stabbing. It's local or it's radicular. Again, happy to answer any of your questions or concerns at the clinic here. Please give us a call at your earlier convenience. Again, everyone, the earlier we get you in the clinic, the easier it is to detect and to correct. The longer you wait, the harder it's going to be, the more costly it's going to be, and the more pain and suffering you, your family, or friends are going to experience. Again, early detection, early correction. Everyone, I'm Dr. Tom Johnson from Klein Total Center, your one-stop holistic healthcare shop. Aloha, mahalo.